and live in West Hartford. So I'm here to provide testimony as a dentist, a surgeon, advocate for my state association, as well as a parent and for as a resident of Connecticut. First of all, I want to provide support for HB 6832 as well as SB 6. They're both very important bills and are going to be very helpful. First of all, I think electronic transmission of prior authorizations would be extremely helpful. Currently, my staff spend at least 1 to 2 hours per patient on obtaining prior authorizations. Because of that considerable burden, I've looked into different third-party processes that will kind of take some of that weight off of you. But even with that, they have strict requirements that make it sometimes not very beneficial for patient care while the patient's in the office, and they're extremely expensive. So I'm very much in favor of an electronic submission. And then also very much in favor of the standardization that's within the bill. I think standards are absolutely necessary. Right now, the prior authorization process is extremely confusing and difficult to manage and somewhat impossible at times. Quite often, the private carriers won't tell you what they need and what information is required and what data is required for them to provide approval or decline. And so it's a lot of back and forth where submitting information and then getting a letter back saying it's insufficient to provide one thing. And we've had times where they've come back a second time or third time asking for more information when they could have just asked it in the first place or just told us what they wanted. Usually we end up trying to send a ton of information, and often the information they're asking for doesn't really even make clinical sense for being necessary to make decisions. I'd also like to just provide support or agree with some prior testimony from Dr. Gordon, specifically mentioning that the peer-to-peer is not peer, and it's not even close at times. I've had to have discussions with obstetrician and gynecologists about facial reconstruction, and when they're asking me questions and that don't even make sense, I'm asking, do you even know what surgery we're talking about? And they're like, I have no experience with it. They're just reading a piece of paper and trying to get questions answered. And then I'd also agree with Dr. Emmel's comment that even though this bill may not affect the entire healthcare reimbursement, and by all means, even though it may only affect 25% of reimbursement through private carriers, definitely think it is still very important. Healthcare reimbursement is extremely complicated and requires a multifaceted approach. So we need to be finding solutions in lots of different ways. There is no one magic bullet. So to look at any one bill or any portion of a bill and say, is this going to fix everything? If not, throw it out the window. That makes no sense, and that is just not logical. I've had experiences where prior authorization is significantly delayed care and has required patients to maintain their condition not being fully diagnosed for extended periods. Generally, these are related to patients with TMJ problems with their jaw joints, where requesting imaging, and imaging requires prior authorization.
Eclipse, can you please summarize?
Sure, absolutely. I guess in summary, otherwise, I'm looking to support that prior authorization, these two bills, as well as that they should be added or amended so that prior authorizations should be binding in their agreements.
Thank you. Any questions? Seeing none, Dr. Fenton, thank you for being here today.
Thank you.
Evilise Carrera, can